Hi Shannon, I'm doing your critique on your neuromuscular assessment. You did an overall pretty good job. I loved your, wittiness and how you guys were interacting pretty good with one another. I did notice things that I know that you didn't mention in the front or in the beginning. You didn't wash your hands, provide privacy, or introduce yourself to the patient. You did introduce yourself in the beginning of the video, but you didn't introduce yourself to him specifically and ask him his name and date of birth. I didn't hear you mention that you checked the chart and any previous medical records, and I didn't hear if you said you gathered your equipment. You did ask lots of questions for subjective information, and that was good. Maybe just focus on maybe asking the questions a little slower and give the patient a little bit more time to respond. You checked his posture. That was good. I missed that one. You did the body movements, grooming and hygiene, and how he was dressed. You said normal, maybe mention no abnormal movements such as tremors, jerks, etc. State the client looks clean and taken care of. You did did A&O ×3. Now on the ×3, the part where he didn't know the date, in the future, if it was for a patient and they didn't know the date, I would then ask a couple more questions such as, do you know if it's night or day or what season it is, so you can in fact say they are alert and oriented ×3. You said that I didn't hear you say anything about facial expression, such as his facial expression is calm and appropriate or pleasant. I didn't hear you say that his speech was clear. I could have missed it. I could have missed some of these things anyways. I watched it numerous times, but maybe for the mood and effect, I didn't hear that either. So maybe say he's calm and appropriate to circumstances, or things like that. You did orientate him to person and place, and like I said about the time, I would have just asked a few more questions. You did say that his thought process was logical. In the future, I would ask a few more questions for thought process, like maybe if he remembers what he did on the previous day. You did use the Glasgow Coma Scale. Maybe I would have tried to memorize a little bit of that and not use the paper. And you could just state his eyes open and shut when I asked him to, and that would be a 4. He could wiggle his fingers for 6 points, and alert and oriented ×3, that would be 5 points. So there's your total of 15 points. I didn't see if you asked him to wiggle his fingers for the 6 points. Maybe verbalize something about if something's not normal, ask them about suicidal thoughts or something if you think that the patient's a little off or something. You did do the gait. I liked how you showed the patient how to do it and what they were supposed to do. You did the Ronberg test. Maybe just state that cranial nerve number 8 is intact. I didn't see the finger and nose touch. I missed that one as well. Babinski reflex, I seen that you did do that. Good job on that. Maybe just make sure in the future that you can see what you're doing on the camera so that the teacher knows that you know what you're doing. You did the finger grasp, but you said finger pull, which is funny, but I know what you meant. You did the push and pull of hands. On the lower extremities, you did have him raise his legs. I think we're supposed to provide resistance when the patient lifts it up. I think you're supposed to put a little bit of resistance down, and they kind of put their legs straight up against the resistance on both sides for muscle strength. The push and pull feet, that's where you put your hand on the patient's foot and have them push down like on a pedal, and then touch the other side and pull back towards their head. But you did mention it, so good job on that. You did the neck shrug, and you did state that was a cranial nerve. It's not ocular nerve. I don't even know what the name is, but I know it's not ocular because that would be your eye. So good job on that, though. You did perform it. And you did the neck strength and head turn. I didn't see if you did palpate any of the muscles and joints, but overall, good job, and just keep up the good work and practice, practice, practice. Have a good night.